One of the things I've found since I've been the nurse consultant for dementia is quite often that family carers become quite anxious and quite distressed, especially when their loved one's in hospital. And so what we did in order to help that is we set up some dementia carer cafes. These are carer cafes that are run within the hospital sites. They're held once a month, just for an hour, and it's a space where carers can come by themselves without the person that they're caring for to get that support that they quite often need. It might be signposting to services that are available within Fife. It might be educating them about a diagnosis of dementia, but a lot of the time it's just listening to their concerns, their worries, letting them talk about the issues that they're facing in a supportive environment.
I felt at the time I didn't know very much about dementia. I decided that I needed to know more about it, and I thought if I went along to a carers cafe, at least I would meet other people who were in the same boat as myself and who could provide me with support, and perhaps even I could support some of them.
I think one of the things that I found really useful was it was the first time that I'd felt comfortable speaking about it. Friends would tend to come in and say what's happening or how are things. I actually felt as if I was going behind their back and had sort of guilt feelings just discussing it. And the first couple of meetings that I went to, I remember actually coming out and feeling almost on a high, just because you were able to speak. The people that were there, they were either professionals or there were people in exactly the same situation as yourself. So it was so much easier simply to speak.
Another resource that we have for carers whilst their loved ones are in hospital is the Fife Carers Centre Hospital Link workers. Carers can be referred to those link workers to get support around the caring role. It might be signposting them to what benefits they might need, getting a carers assessment, and getting them in touch with other services that are out there within Fife that might support them. Carers have fed back to me that they're a valuable resource. They've found them really useful, really helpful, and really supported them in their role as carers when caring for someone with dementia.